Everyone. There you go. That was my cue. It's good to see you all here. Thank you for joining us today. Happy Friday. I want to welcome you to the UC Migration Center's virtual book talk series. I'm Stephanie Canizales. I'm a faculty member in the Department of Sociology at UC Berkeley, where I'm also the director of the Berkeley Interdisciplinary Migration Initiative, or BIMI. Every first Friday of the month, BIMI co-organizes a monthly virtual book talk series alongside UC Davis's Global Migration Center, UCLA Center for the Study of International Migration, and UC San Diego's Center for Comparative Immigration Studies. This month, we are so honored to be joined by Dr. Tiffany Joseph, who's the author of the recently published book, Not All In: Race, Immigration, and Healthcare Exclusion in the Age of Obamacare. Dr. Joseph's research and teaching interests explore race, ethnicity, and migration in the Americas, the influence of immigration on the social construction of race in the US, immigrants' health and healthcare access, the impact of policy on people's lives, and the experiences of faculty of color in academia. We will be hearing from Dr. Joseph on Not All In for about 40 minutes, and then open up to audience discussion and Q&A for the last 15 or 20 minutes of our time. In the meantime, please feel free to drop questions in the chat along the way, and I'll be happy to field those questions at the end of the talk. Thank you all again for being here, and I'll turn it over to Dr. Joseph.
All right. Thank you so much for that introduction, Stephanie. Good afternoon to all of you. Thank you so much for making time in your busy schedules to be here. I will go ahead and get ready to share my screen so we can get started. All right. Can everyone see my screen okay?
We can see it, yeah.
All right, great. Thanks. I'll
It
get ready.
does, just want to flag that it does have the notes around it. I don't know if you want to
Okay,
change
I'm going
the.
to get ready to share this around, do the presentation. Let's see if they still show up. All right. Do you all still see
Perfect.
any notes there now?
No, you're ready to go.
Okay, great.
Thank you.
Thank you so much for that, Stephanie. All right, so basically, I'll go ahead and get started and talk about this book that I recently published, which is based on nearly a decade of research that I've been doing, really trying to understand the intersection between immigration and health policy in the US, particularly amid a wide range of health policy changes that were implemented over the course of the time that I did this research for this book. So to get started, I just want to, let me see if I can get this part off the screen. There we go. All right. So to get started, I'd like to just open with a couple of quotes that open the book in terms of highlighting Massachusetts as one of the best places in the country to get access to healthcare because it was the first to implement comprehensive health reform almost 20 years ago in 2006. And that reform was so successful that it eventually became the model for the Affordable Care Act, almost known as Obamacare, when it was signed into law into 2010. But even though Massachusetts has world-class healthcare facilities and has politically been committed to providing healthcare access for all of its residents, there have also been some challenges that certain segments of the population, particularly immigrants and people of color, have faced accessing care in Massachusetts, and particularly in Greater Boston, where I did the research for this book. My first quote from Victoria, a Dominican immigrant that I interviewed in 2012, basically highlights sort of this best case scenario of healthcare as a Dominican immigrant. But at the same time, a healthcare provider that I interviewed talked about some of the challenges that he sees from his immigrant patients around discrimination, language issues, and how, in order to provide adequate care to his patients, he really has to understand all of the social context that they're living through as a really important aspect of the healthcare experience. And so, what I'll be doing today is talking a little bit about how the intersection of race and legal status played a role in shaping Latino immigrants or Latinx immigrants' access to healthcare under health reform. So, the concept of racialized legal status is a term that's been used increasingly in recent years by a number of social scientists to really try to understand how the intersection of race, ethnicity, and legal status are important for people's lived experiences. And this is really important because it really demonstrates how, in terms of laws and policies, that legal status directly shapes access to healthcare, other social safety net provisions, one's ability to get driver's licenses. But at the same time, for people who are racialized as folks of color, race and ethnicity, given the history of racism in the United States, has also played an impact on or had an impact in people's lived experiences as well. And so, in a lot of the work that I've been doing for much of my career, I've really been trying to understand that connection, and a number of other scholars have as well. And I see this concept as really important because it really brings together the scholarship on race and immigration, which I feel like through much of my career have been sort of siloed. But I've been happy to see that within the last decade or so, a number of scholars have really been drawing attention to why it's really important to look at these intersections of race, ethnicity, and legal status, what we think of, or what people have increasingly been called racialized legal status. In my book, what I do is I take the concept of racialized legal status and really try to demonstrate and create a framework to show how this exists at multiple levels in US society. First, at the macro level, we have to think about the impact of policymaking, and how, when our legislators are thinking about what sorts of policies they're going to put in place, whether they're going to support them, implement them, that structural racism has really been a part of that process from the beginning of the nation's history. And additionally, legal status has also explicitly shaped access to a wide range of social benefits in the United States at the federal and subnational levels of government. Racialized legal status also operates at the meso level whenever people have to engage with institutions and bureaucracies. So, if you want to sign up for Medicaid, for instance, usually you have to do that and interact with some sort of bureaucracy or government office. And of course, your legal status is important for determining your eligibility, but a lot of research has also demonstrated the subtle ways in which race and ethnicity have played a role in perpetuating structural racism within organizations, and also creating significant difficulties called administrative burdens that people have anytime they need to get anything from the government, whether that be to try to register to vote, to sign up for Social Security, or what have you. That at the meso level, these distinctions around racialized legal status are also important. And then finally, at the micro level, in people's individual and everyday lives, this intersection of discrimination really plays out in a wide range of ways. So when you're interacting with other people, as you're going about your daily life, one of the examples I'll talk about in the talk a little bit later is in terms of thinking about immigration enforcement in Greater Boston. If you're at a T station and ICE is picking up people or trying to determine who to stop, they're going to be looking for people who are racialized in certain ways to determine whether or not they think those people are undocumented or are not US citizens. And so that is a really important way that at the micro level, in terms of people's movement and the way they experience their everyday lives, that this is important. This is also really important too because it really demonstrates that citizenship isn't experienced equally in the United States. So for people of color, regardless of their legal status, they are still subjected to discrimination, even if they are recognized as legal citizens. But on the basis of their race and ethnicity, they might not be fully treated as such. And I'll talk a little bit more about the role of language access. But in terms of thinking about language and its connection to race through the 1964 Civil Rights Act, basically what this argues is that if a person doesn't have access to appropriate language resources when they want to engage with any sort of institution that receives federal funding, that that is basically a form of racial discrimination and an infringement on their civil rights. And so that's one aspect of the racialized legal status framework that I really draw attention to in the book, in terms of how language is used as a way to racialize people as well. And then I'll go ahead and just move over into this next slide here, which is basically a figure kind of walking through what I just explained on the previous slide. So I won't go into as much detail here because in the interest of time, but I'll just quickly say that here I basically try to show here at the macro level with the role of federal policy, how it's really important because it creates race and documentation status categories. I talked already about sort of federal restrictions with regard to legal status, but also in terms of race and ethnicity, the Census Bureau is responsible, or the Office of Management and Budget is responsible for creating the racial and ethnic categories that we often use in everyday society in terms of thinking about the census and how those categories sort of get dispersed into the broader population. And so these category differences on race and documentation status play a role in creating resource allocation stratification. So when the government is trying to determine what sorts of funds are going to be allocated for particular policy purposes, documentation status is used as a basis for doing that, and race is more implicitly used as a basis of that. And so this has implications when we think about all of these different policy realms within our society. And in my particular book, I really focused on these two in healthcare and immigration policy and how their overlap really shapes people's experiences. Really briefly here, I'll just sort of say in terms of thinking about how these categories sort of map out onto each other. In the US, there are a wide range of documentation statuses that exist from undocumented to citizen, with a wide range of categories in between. And the closer you are to the citizenship category, at least before the second Trump administration came into place, usually if you were recognized as a legal citizen, that would be protection from deportation. We know that that is now not the case, that anyone can basically be targeted, especially if you are racialized as a person of color. But when I was writing the book, this was still the case under that policy context. So we can talk a little bit more about sort of what I see as changes or shifts in this framework since I've written the book and where we are at this moment. And then lastly, too, just in terms of thinking about the impact of race in the United States throughout its history, typically people who have been racialized as people of color or as non-white have often had access to less unequal or to more unequal resource allocation. And that's really played a role in shaping a lot of the disparities on the basis of race and ethnicity compared to individuals who are racialized as white. And this really has implications for a wide range of incomes that are related to these policies that get passed by our legislators. In the background here, you will see these diagonal lines, and these basically symbolize systemic and structural racism, just to basically show that these things are sort of always operating in the background, even if it's not always explicit or obvious that that's happening in terms of this process of how racialized legal status functions, particularly with regard to public policy. On this next slide here, I really have an example basically demonstrating how this plays out at the micro level in people's individual lived experiences. And whenever I talk through this slide and in the book, I describe this as, if we think about a policy like NYPD's stop and frisk policy that existed. That basically a person, if you were racialized as a person of color, particularly as Black or Latino, if you were, on the street or in a subway station, that you were more likely to be stopped. And so we can think about a similar scenario happening here. For instance, in Boston, if you're going through the T station and the police or ICE are there. Here in this corner, basically I have someone who's racialized as white or a lighter skin toned US born citizen. This person would be least likely to be initially stopped, but if they are, they don't have to worry about being deported. Over here towards this other side here is someone that is racialized as white, but is also undocumented because of the racial and ethnic, because of the way this person is racialized, they would be less likely to be stopped. But if they are, they would be more likely to be deported. If we move down here to this bottom part of the quadrant, which is where people who tend to be most racialized in US society are located, if someone has Black or brown or darker skin tone, they are most definitely or much more likely to be stopped. And if they're undocumented, they would be likely deported. And then here, in terms of citizenship, even if someone is a US born citizen, they would also be likely to be stopped. As I said before, when I was writing the book, probably not as likely to be deported, but certainly in an encounter with law enforcement, that you could likely be arrested. And in a number of high profile cases that we've been hearing about in recent years, potentially killed on the basis of an interaction with law enforcement. And so basically the idea here is to basically show how, in terms of thinking about the intersection of these, some of the most common documentation status categories that exist that shape vulnerability to deportation, how that intersects with whether more, I'm sorry, how that overlaps with someone's likelihood of being racialized as white or as a person of color, and how that shapes their experiences in the US. I'll just also quickly say that when I was trying to develop this concept, I really was struggling with how to sort of think about writing this part here. I knew that I didn't want to put like a hierarchy of specific racial and ethnic groups, because I feel like over time, people's experiences with visibility of racialization has shifted in the US context. And so I ended up settling on this concept of least racialized, and basically saying that being related to people who have typically been racialized as white in the US, and using most racialized for people who are Black, could also be brown, um, as most racialized, because those are the groups historically that have been most visibly racialized and targeted and treated differently on the basis of the way in which they are racialized. But because our times continue to shift, we could also put in other categories here too, in terms of Black or darker skin tone as well, to basically sort of symbolize how this can sort of shift over time. But to move on, I'll talk a little bit briefly about the data and methods before I get into some of the findings from the book. For this project, I basically did a policy analysis of the Massachusetts and Affordable Care Act reforms, because I really wanted to understand how documentation status shaped eligibility for coverage under both of those reforms, but also too in terms of thinking about what are some of the subtle ways that race and ethnicity, particularly its overlap with social class, played a role as well too in thinking about how these reforms shape people's healthcare access, especially because income level is one of the factors that is used to determine someone's eligibility. And there's a strong overlap between race and social class in the United States. I also really paid a lot of attention to the intersection with immigration and welfare policy, because documentation status definitely shaped eligibility for coverage under both reforms. I did in a number of interviews, 207, or I should be 209, I forgot to correct it on this slide, with three different stakeholder groups in Greater Boston. I wanted to focus on immigrant groups because I really wanted to understand their experiences navigating the healthcare system, getting access to coverage under these reforms, and also how at that time the shifting socio-political climate around immigration was starting to have an impact on their healthcare decisions. I also wanted to interview healthcare providers because I wanted to understand from their perspective how these reforms, if they were being implemented, had an impact on their ability to provide care to their immigrant patients. And then lastly, I interviewed a wide range of immigrant and health advocacy organization employees, because I wanted to understand what else was happening in Greater Boston that might be shaping some of the healthcare decisions that immigrants were making. So, for instance, over the course of the time that I conducted this research, if you were an undocumented immigrant, you could not get a driver's license in Greater Boston or in Massachusetts. And this really had an impact on access to healthcare, because under the state's health reform, anyone, regardless of documentation status, was eligible to apply for coverage. And so this created a disconnect between issues of transportation and ability to actually use that coverage to get care. If you didn't have reliable public transportation, it put you in a position where you might have had to think about driving without a license. And so this really sort of, that's an example of how those two things were at odds. And I was trying to understand from employees, were there other sorts of things like this happening in Greater Boston that might also be having an impact. And so ultimately, I really wanted to understand how the role of racialized legal status shaped people's experiences in the healthcare system and their lived experiences. Here is a table that includes the different groups that I interviewed over the course of the study. I did this research over nearly a decade. And when I started this project, that was not my goal. I thought that I was just going to be doing research in this time period here. I was doing a postdoc at Harvard with the Robert Wood Johnson Foundation. And at that time, the Affordable Care Act had just been signed into law, but not yet implemented. And so the Massachusetts health reform was what was still in place. And I wanted to understand, what are immigrants' experiences under the Massachusetts health reform. And in the course of doing those interviews, a number of the people that I spoke with were excited about the ACA having been passed into law and moving towards implementation in 2013, but they expressed fears about how this would reconfigure or limit healthcare access for immigrants in the state of Massachusetts because of the federal restrictions around documentation status were much stricter under the ACA than they had been under the Massachusetts reform. And so I heard that from a number of people during this period. I also just want to briefly say, before I talk about the other time periods, that I decided to focus on these three immigrant groups in Greater Boston because they're three of the largest immigrant groups. They are all from Latin America, but from different parts of Latin America, and they're all racialized differently and have a range of documentation statuses. Brazilian immigrants tend to be undocumented. Many of them come to the United States with tourist visas and overstay them, which is how they become undocumented. And because of the way racial stratification works in Brazil, many Brazilians are racialized as white in the US context. Dominicans, on the other hand, tend to be green card holders or naturalized citizens, and they're also racialized as Black in the United States. And then finally, Salvadorans, some of them were eligible for temporary protected status, and also too, in terms of documentation status, but in terms of racialization, they tend to be racialized as brown or have more mestizo Latino characteristics. So when people think about Latinos and how they're racialized, Salvadorans, at least among these three groups, tend to be more likely racialized as Latino. And I really wanted to understand how those differences in racialization, documentation status, and also pre-migration socioeconomic status played a role in shaping these groups' experiences. To move on, in terms of 2015 to 2016, I decided to go back to Boston after the ACA was implemented because I really wanted to understand and see if what I'd heard in terms of concerns about ACA implementation, how that was going to reconfigure healthcare access. So that's why I did research then. You'll notice that this time period also coincided with the 2016 presidential nomination process. And in my interviews in 2016, when it looked like Trump was going to be the nominee, I started hearing respondents talking about Trump in the interviews, saying that they were already seeing immigrants in Greater Boston disenrolling themselves from health care, from other social safety net provisions that they were eligible for, out of fear that that could be, if Trump were elected, that their usage of those programs could lead to them being targeted and detained and deported by ICE. So this was even before the election happened that I was hearing that. And so after the election happened, I kept thinking about all of those interviews with those people in terms of sort of the fear that I was hearing already happening in Greater Boston. And I thought it would be important to try to do a final round of data collection, which I did in 2019. You'll notice that the number of immigrant respondents is significantly lower in 2019, and that's because despite the fact that I speak Spanish and Portuguese, that I had been very embedded in the communities doing research and volunteering with some of the organizations, I had a very difficult time recruiting immigrant respondents for the final year of the study because of the social climate at that time. Here's a little bit of information about the immigrant sample. You can see that it was mostly women, mostly middle-aged people who had been in the United States for a very long time. A wide range of documentation status is represented among this group. And even with that wide range of statuses, there were very few people that I interviewed who were uninsured. And what I think that does is it speaks to the success of the Massachusetts reform, even after Obamacare, its implementation, to really be able to use state level funding to still be able to provide access to some type of coverage and care for the undocumented population or immigrants even immigrants with documented status who might not have been eligible at the federal level for ACA provisions like Medicaid, for instance. So, with that being said, I'll go ahead and transition to talking about some of the findings from the study. And what I will be doing is highlighting the study, data from the study from 2019, the last year that I collected data for the study, and which coincided with the first Trump administration. So, I've really been doing that when I do the book talks because I think it's important for people to sort of think about where we were under the first Trump administration, the parallels to this moment, but also picking up on what is very different about Trump 2.0 as well. So I'll just start by setting the scene a little bit from Daniel, one of the health advocates that I interviewed. And he basically said, I think the challenge is dealing with this administration every single day. There's something new and it's like a bomb. Immigrants don't know how to deal with it and it instills fear in them. And so just a lot of uncertainty that I just heard from a number of advocates in 2019. Um, Particularly health and immigration advocates who are trying to keep up with the rapid sort of announcements that were coming out every day that it seemed like at that time around immigration policy, attempts to repeal Obamacare, and what have you at that time. And so, to start, in terms of thinking about racialized legal status at the macro level and how that came out in my data, this came out in terms of thinking about the ways in which government, through policy, perpetuates structural racism and anti immigrant discrimination at the federal level, but also at subnational levels, in terms of thinking about what's happening in state and city and county level governments as well. So, at the time that I was doing these interviews in 2019, was when the Trump administration was trying to change the public charge rule. Um, to basically make it more difficult for lower income people who wanted to immigrate to the US, apply for green cards for that purpose, to be able to come to the United States. And so Joshua, a health advocate that I interviewed, basically talks about how we really have to understand that there is an element of racism involved in the changes that we're seeing in immigration policy, certainly in 2019. And he says, so we have to think about the history of these policies throughout time. And then he talks about how public charge has existed for over 100 years and how at that particular time in 2019, that the policy started to become more focused on people from Mexico, Central America, South America. And he says there's this deeply embedded in the policy, a racialized element. And it's not explicitly racist, but it's done through subtext. And so, in terms of thinking about sort of the subtle ways or the implicit ways in the associations that people make between race and social class and race and immigration, that if you make it difficult for lower income people to be able to get green cards to come to the United States, then you're also shaping sort of the racial demographics, the racial and ethnic demographics of who is able to come to the United States. Another way that this came up too is in terms of my interview with Javier, an immigration advocate, who basically talks about at the turn of the administration that basically people were starting to take themselves off of public benefits because they were worried about how they could be affected in terms of if they wanted to apply for citizenship later. They were really worried about how this could affect their ability to change their status, particularly because the demographics of the immigrant population is predominantly people of color and has been for some decades now. So, to move on and talk about how this operates at the meso level, one of the things that I heard about too was the issue of language access and how it was just a lot harder for people to apply for coverage. And a big piece of that was issues of language in terms of there not being language appropriate access there, and how this overlapped with race and ethnicity, particularly for the immigrant communities that I was interviewing. So Josefina, a Dominican advocate, basically talked about in healthcare facilities that the attitude is, oh, we don't like or deal with Latinos here. Even when going to the hospital, you can't find someone who speaks Spanish, and they don't try to find anyone who does, because the message that they're sending is that they don't want Hispanics there or to learn English or leave. And so, in this quote and in a number of the other interviews I did, there was often this connection that was made between language ethnicity and race, particularly for the Latin American populations that I was doing research with. So either if people spoke English with an accent or if they didn't speak English, that could be used as a basis for racializing people and then people being treated in a discriminatory manner on the basis of that. Here and now, so I'll just move on again in the interest of time to talk a little bit about at the micro level. And so, in people's individual lives, one of the things that came up as well was in terms of people's concerns about potentially being pulled over, treated differently by police, by people in their everyday lives. Because of this perception that people were undocumented or were not American because they were racialized as Latino or Latinx. And so, here in this first quote from Magdalena, a Salvadoran immigrant that I interviewed, talks about the issue of language and how she felt like she sometimes experienced discrimination on the basis of that. In this particular example, when she tried to get help from customer service, they didn't have any assistance available and she was treated in a not so polite manner. But when she called back in English, she was able to get the help that she needed. So, again, the role of language as a racializing factor coming up. And then here from Gloria, one of the BHT or healthcare providers that I interviewed, basically talked about how her Latinx patients feel more unsafe in terms of society, largely due to the quality of the language they speak and their race. Now there is freedom, and basically, she was implying, and it later in the interview, basically talked about for people to openly express bigotry and racist rhetoric, and how language was a part of that too for her patients. One of the things I'll just mention quickly too is that also at the micro level, one of the things that I really saw come out a lot in the 2019 interviews was a number of the advocates that I interviewed who were also members of these communities, but naturalized citizens also talked about how the socio-political climate was also creating difficulty for them in their personal lives, aside from the work that they were doing, trying to connect different communities with healthcare access in Greater Boston. So Cecilia, a Central American naturalized U.S. naturalized citizen that I interviewed, basically talked about how she was walking down the street one day in Boston, and a white woman just threw coffee at her and said, "You should be out of here. Go back to your country." And Cecilia was like, I was speechless. And I was too. When she told me that, I was just like, what happened? Were you okay? Did you get hurt? And she told me, like, it was winter. I had on a coat, so I didn't feel the coffee. Fortunately, I didn't get hurt. But again, this is an example in a place like Boston, which people often think of as a blue state, very progressive, very liberal city. And then walking down the street, this happened to Cecilia. Sebastian, a Brazilian, also a U.S. naturalized citizen, also talked with me in our interview about how even though he's a citizen, I don't always feel like one. We are on the defensive all the time because we don't know why people are treating us in certain ways. And at another point in our interview, he basically told me that he carries his passport card with him, his U.S. passport card with him everywhere he goes because he wanted to have some proof of his U.S. citizenship on his person at all times in case he got harassed or pulled over or something like that. And so I heard this from some of the advocates that I interviewed who were naturalized citizens, and also from some of the immigrant respondents as well who were naturalized citizens who talked about how they didn't feel like being a citizen protected them from the type of racial and ethnic discrimination that people were encountering and feeling on the basis of not being racialized as American or not presenting as white, and how that led them to have more challenging experiences under the Trump administration at this particular time. So I'll just briefly talk about some of the healthcare implications of this, and I'll start with the quote by Javier again, who basically talked about before the Trump administration came into place, at health centers, healthcare facilities, you would see people seeking services, and then right after the presidency started, the health center was empty. Nobody was coming. And he really talked about how we need to make sure that people feel safe bringing their kids and getting medical services, because if we have any type of dip in that nature, this can have a ripple effect on the broader public. And I just like to mention that I finished my interviews in 2019. It was like November 2019 when I stopped or completed the data collection for the project. And COVID happened a few months later. And so I just kept thinking about this interview with Javier once COVID unraveled. And most of the communities where I had done research had been some of the hardest hit in Greater Boston in terms of rates of COVID and deaths from COVID. To really sort of bring the point home that Javier is making here or made here before COVID happened. Here is another quote from a Brazilian, another naturalized citizen that talked about how people were afraid to go to the hospitals because of this fear that if they got medical help, that that would be an impediment to wanting to adjust their status in the future. Madeline, a BHC provider, speaking to the fact that even people who should not be worried about their documentation status, who are now citizens, are still feeling the mental health effects of what's happening, particularly this rage against immigrants of color. Even though these people should have no reason to legally be in fear, but they are, or they were. And then from an immigration advocate that I interviewed who basically talked about how she feels that collectively our communities, anybody in this space has been mentally attacked, our mental health has been under siege. So, as I get ready to transition to getting ready to conclude the talk, I just want to briefly mention that one of the things that came up in my study, or one of the unanticipated findings, was that even though these reforms, the Massachusetts reform, the ACA reforms, were passed into law to extend access to coverage, that didn't happen for immigrant communities in Greater Boston. What I found in my research was this perception that as these reforms came into place, it actually made coverage more difficult to get for immigrant communities. And this is basically what this BHC provider that I interviewed is speaking to in terms of talking about how, over the course of his career, he noticed that as these reforms came into place, it became more difficult for his immigrant patients to get access to care. And he said that they are less likely to have insurance. So, in terms of thinking about conclusions and broader implications, racialized legal status affects people's experiences at multiple levels in terms of thinking about policies, their implementation, the impact that they have at the federal and subnational level, when people have to engage with bureaucracies and institutions, especially those that are connected to the government and these policies. And then finally, in people's individual lives in terms of discrimination they experience from other people, but also from law and immigration enforcement officials. In terms of broader implications, one of the things that I found in my research is that even in subnational contexts where there is more eligibility and more inclusion for people regardless of their documentation status, that restrictive federal policies can undermine those policies. And that's exactly what happened in Greater Boston in terms of thinking about the Massachusetts reform, and then once the ACA got implemented, how it really made it difficult for undocumented and other federally ineligible immigrants to get access to coverage. I talked about marginalized citizens also being affected by this and really demonstrating this difference between what's referred to as legal citizenship compared to social or cultural citizenship. And this is really important because legal citizenship doesn't protect citizens of color or other marginalized citizens from discrimination that they can experience. And this extends beyond the healthcare setting to really shape people in their everyday individual lives. So I'm going to get ready to close, but I just want to briefly mention, in terms of thinking about some of the major policy shifts that are happening, particularly in terms of healthcare, that are going to be happening in response to the Big Beautiful Bill. One of the things that I've been seeing in my research and that I've been writing about quite a bit in the last few months, certainly in op-eds, is that what we're seeing is that the exclusion that immigrants have been facing since the 1970s incrementally in terms of social safety net provision, that that's now expanded to include citizens. And so the Big Beautiful Bill has basically codified that. and the increased difficulty or administrative burdens that people will experience trying to just sign up for coverage, navigate the system is basically going to undermine healthcare access, which is what I found in Greater Boston for immigrant communities. Here, the Medicaid cuts that are coming, the shorter enrollment periods means that 17 million people may lose coverage. And then also, too, if we think about where we are in this exact moment with the government shutdown over ACA subsidies, that essentially we're headed to a place where it looks like the Affordable Care Act is ending. And rather than that happening through an explicit repeal, which is what Trump tried to do under his first administration, they've basically been targeting it one piece at a time, starting with the Medicaid expansion, which is going to be going away or significantly impacted with the big beautiful bill. If these ACA subsidies for middle income people expire, that will be another piece. And these other two pieces have already happened in terms of the individual mandate. That went away with the 2017 Tax Cuts and Job Act. And also funding for healthcare navigators was cut earlier this year, right after the Trump administration came into place. So we're really at this moment where we're seeing a lot of shifts in terms of health policy, immigration policy. We can certainly talk a lot more about this in the Q&A, but yes, we're in a moment where all of these things are shifting, and I think it's going to be incredibly important to do what we can in terms of through advocacy, through activism, through organizations. I'm feeling a little hopeful after the election on Tuesday that we might be at a turning point in terms of thinking about sort of the broader impact of all of these policy changes, not only on immigrants, but how that exclusion that immigrants have been experiencing is now expanding to include US citizens as well. So I'll stop there and I look forward to talking more. Thank you.
Thank you so much, Dr. Joseph, for that insightful talk and for doing that so well in such a short amount of time. Lessons to be learned on many fronts. But thank you. If folks want to drop some questions in the chat, I'm happy to read them aloud. But if you want to unmute yourself or come onto video and ask a question, also happy to welcome you into the space. I can start us off with a question. Or Vanessa, go ahead. Yeah.
Hi, Tiffany. Hi, everyone who helped set this up. And it was really great to learn about your work. One of the things that I was really interested in is if you could talk more about how class played a role in whether there was access to healthcare or if those were elements of exclusion for your participants. And I asked that because I'm doing research in the state of Washington, and I've done research in California, both of which have expansion programs that provide access, limited, but some access to undocumented immigrants. And one of the things that has frequently come up in my interviews is, how meeting poverty thresholds is very limiting or excluding in itself. And so I was wondering if that played a role, because I had folks that were undocumented but became entrepreneurs and now earned over the 100, I think it's like 138% poverty line or whatever. And so I was just kind of curious about, we learned a lot about the race and immigration status, but did class play a role in your interviews?
Absolutely, and it did in two ways. So the first way is in terms of thinking about pre-migration socioeconomic status for the three different groups really seemed to have a big impact. So I mentioned before that Brazilian immigrants tend to be come to the U.S. on tourist visas and become undocumented by overstaying them. I collected a lot of data in my interviews on people's pre-migration backgrounds in terms of what they did, if they could remember their income, their levels of education. And so there were definitely differences between the three groups on the basis of that. Most of the Brazilians that I interviewed tended to be from middle class backgrounds in Brazil. Some of them had high levels of education, so college and beyond. And many of them, I also asked people, did you have access to health insurance before you migrated? Was it public or private? And what were your experiences with the healthcare system? most of the Brazilian immigrants had access to private health coverage in Brazil before they migrated. And so that becomes really important because that is sort of the entry point for thinking about how people began to navigate the US healthcare system. What was your experience in your country of origin? And I mentioned Brazilians, but conversely, I found that the Dominican and Salvadoran immigrants tended to come from lower socioeconomic backgrounds, didn't have access to health coverage before they came to the US, and they had lower levels of education. And so, in terms of when they got to the US and were trying to navigate the system, that put them at a disadvantage relative to Brazilians. And I would even hear from some of the healthcare providers, particularly that had a wide range of immigrants from Latin America, would often say that they felt like the Brazilian immigrants had really figured out how to navigate the US healthcare system, even with the fact that Portuguese is not as readily available, in terms of getting assistance from navigators or other languages as Spanish is. And so they had been able to figure out, in terms of their community networks, sort of these are the doctors or these are the places to go to see Portuguese speaking providers and to do all of that. The providers even talked about noticing that the Brazilians were more easily able to navigate the system, to be able to figure out how to sign up for coverage, and then to be able to navigate the system in a way that the Dominican and Salvadoran immigrants were not. And so that's the first piece, the pre-migration socioeconomic status. The second way that the class came up was also in coverage. You mentioned people being concerned about the threshold. I heard about that in my interviews as well, too, with some of the advocates who would say that people were afraid that if they started to earn too much money, then they would lose the coverage, the subsidized coverage that they had. And then also, too, just even in terms of thinking about the program in Massachusetts, which still exists, the Health Safety Net program, which is how people, regardless of their status, can apply for coverage and get it. Over the course of me doing the research, they lowered the income eligibility threshold for that. And so what that meant was that people who had access to that coverage before could not get it anymore. And so over the course of the study, people lost their eligibility if their income level was too high. And so, yes, class definitely was a big factor that came up.
Oh, Cecilia has her hand raised.
Yeah. Hi, Tiffany. Sorry, I have my camera off today, but thank you so much for your presentation. I very much look forward to reading the book. You mentioned two things that I think are very important. One is that there is just so much states can do at the state level. The federal has quite a bit of power over all this. And so I think your book and your work in general speaks to this tension between the two levels of government that sometimes we assume that states can undo what the federal is trying to do, but you show that that's not always possible. And so I appreciate that point to make things more complex. But I have a question as well about another point that you mentioned in passing, but I think is very important. That what we see among the immigrant population has a broader, is one piece of a broader process that affects other racialized individuals who are not, who are US born, who don't have a recent immigrant past. And so I wanted to ask you if I don't know if I missed that you're going to do research or you have started to look into that, or it's something that you mentioned in your book about this broader, not broader effects, is maybe what looking at the lives of immigrants allows us to see about a broader process that affects racialized and marginalized groups in general. So I wanted to ask about that. Very, very interesting. Thank you.
Yes, thank you for that question. So, I did mention in my talk that one of the things that over the course of doing the research, because this project took some time to do in doing the data analysis, but also the policy context kept shifting. And so it sort of kept changing the lens through which I was viewing my data, and even thinking like where we are now compared to where I was when I was writing the manuscript. I feel like so much has changed as well. But one of the things that I've certainly been noticing, in the data, and I write about this some in the book, but I also wrote an op-ed, I guess, over the summer for the Milbank Quarterly about the Big Beautiful Bill, basically saying we are all immigrants now. Basically arguing that in terms of if we look at how since the 1970s, immigrants of various statuses have been increasingly excluded from the social safety net in the US. So this has kind of been a slow and incremental process. It started with undocumented immigrants, then it spread to visa holders, and then by 1996, green card holders also were excluded. And so basically what I argued in that op-ed that I wrote is that in terms of the Big Beautiful Bill, like at first it was immigrants that were being excluded, and now basically the Big Beautiful Bill kind of codifies this exclusion of citizens as well, US born citizens. So everyone is sort of at risk. And that's one of the things that I wrote about in that op-ed, but I've really been starting to think about increasingly, and maybe I will try to write a paper about it. I do walk through some of this in a paper that I published on the documentation status continuum, which basically sort of walks through the wide range of statuses that exist in the US and over time how certain groups have been excluded. And so I started to write, or I wrote about that in the context of health coverage and healthcare access in the US and sort of how it's created this healthcare stratification. But I'm thinking potentially the next step is to think about how that extends to sort of the racialization process. I think also too, in terms of how I wrote about racialized legal status in the book, the context has shifted since then. And so I'm thinking the next step might be to even think about writing an article that sort of kind of updates sort of my thinking on how the current policy context has sort of shifted. Even the way that I think about the framework, as I wrote about it in the book, because as soon as I turned in the manuscript, Trump got elected. So I just feel like so much has shifted in terms of everyone's vulnerability for being picked up by ICE, masked men, masked people, regardless of what your citizenship status is. They're just kind of picking up people that they think don't look American. And so that includes people like me. And that's something that I've certainly been thinking about. In that quote that I mentioned from Sebastian, I also carry my passport card around. I've been doing that for the last probably five or so years for the same reason that Sebastian, the advocate, talked about in terms of this fear of even despite being a citizen. So yes.
Thank you for the question, Cecilia. We'll turn to Paige.
Hi, thank you so much for this talk. I'm like vigorously taking notes and I'm excited to read your book. I guess I had another question about kind of related to some of the other questions, but like place, how place has come up in your research and how you're thinking about that now, again, like with the extremely harmful surveillance and like targeting of different places like ethnic enclaves or even like FQHCs. Like I'm in San Francisco and there's a hospital that is heavily surveilled because it is a place that many immigrants go to get their health care. And I've done some work in North Carolina as well. So just thinking about like rurality and all of that kind of stuff. How are you thinking about that? How did that come up in your book? And yeah, really interested in that aspect too.
Thank you. I think place is very, very important. Because each context or each place or where people are situated is subject to different types of laws and policies and jurisdictions. So to get back to Cecilia's question about sort of state capabilities and sort of how where you are really kind of shapes your experiences in terms of what's enforced, what isn't, what's a sanctuary city, what's not. And even in this moment where there's certainly been this crackdown by the federal government, targeting blue states and sanctuary cities and regions. And I mean, I'm in Massachusetts. I just sort of feel like the level of sort of the level of surveillance and sort of immigration rates and things that I've been seeing and hearing about has just been unreal. I mean, they've been picking up like teenagers here, and particularly Brazilians. And so it's interesting because when I was writing the book and I've been doing research about Brazilian immigrants for my career, and one of the things that I had sort of noticed is that it was a group that seemed to kind of fly under the radar, if you will. And some of that is related to some of the factors that I mentioned in the talk. But certainly in terms of what's been happening here over the last year, most of those teenagers that have been picked up have been Brazilians. And so this idea of Brazilians, at least what I've been seeing, is them being under the radar. That's just not the case anymore under this second Trump administration. And so their visibility has heightened in a way that I would say the Dominican and the Salvadoran immigrants that I interviewed, or those communities, were always heightened. And so I think that speaks to the shift in policy, but also goes back to place too in terms of thinking about how different groups in relation to each other. Again, groups are all from Latin America, but they're racialized differently, their demographics are different, and then even in the same place, how they're regarded differently was one of the things I was really trying to bring out in the book and draw attention to that. And the other thing too about place, to your point about North Carolina, San Francisco, also to sort of the importance of advocacy organizations, and then having healthcare providers and facilities that are just sort of like, okay, we're going to be proactive. We know that there's going to be more surveillance. We need to figure out what we can do if ICE shows up in the waiting room to protect our patients. And so I'm still in touch with a lot of the organizations and providers. I'm on email groups. And so I've been seeing how in different places people are sort of using this moment to try to respond and counteract within the limits of federal policy, but trying to do what they can, particularly I think if they do live in blue states, because I think at least there's not the same sort of collaboration, if you will, with ICE as there are like in my home state of Tennessee, for instance. So that's why I think place is very important. I feel like you see more resistance, more advocacy, more organizations, and everyday citizens as well too concerned, like what can we be doing within the limits of what's happening to sort of speak to and try to create safe spaces in healthcare for people or in other spaces. So place is very important. And I think that matters in terms of people's recognition of where they are and feeling like, okay, there is something I feel like I can do, particularly if the state and city level governments are kind of working against or trying to work against what's happening at the federal level.
Thank you, Paige, for the question. I am recognizing that we are at time, so I want to let anyone who needs to go. I know, Tiffany, you said you had a few extra minutes after the time. So if anyone's heart started racing when you realized we were at the hour because you have a question, I will open the floor to you. Otherwise, thanks, folks, for joining us.
Thank you all so much for being here and your questions. I appreciated them.
Thank you all. Tiffany, if I can steal a few minutes of your time myself, I am curious to know how your framework, you mentioned during the talk and also during one of your responses that your framework has changed. I'm curious to know how that is evolving in the current context.
Yes, so one way that it's certainly evolving is in the x-axis where I had the documentation statuses. I had them separated by undocumented and all of those. I feel like at this moment, none of that matters.
Right.
That documentation status doesn't seem to matter, particularly if you're racialized as a person of color or as if you don't look American, quote unquote. And however, I guess maybe ICE agents are determining that, certainly since the Supreme Court decided that in LA that they can stop people on the basis of race, if I'm not mistaken, or perceived ethnicity. So I think that's one way the framework, I would say that the way that I've written about it would change. The other way that I would think about changing it too is in the diagram with the policies. I would include some arrows going between the macro and the micro level because I don't have any arrows going between those two. The framework as it is in the book is basically sort of this going from federal policy from the macro to the meso to the micro level. And I certainly think that there can be these arrows going between both directions. So basically speaking to sort of directly how what's happening at the macro level in terms of policy can directly affect people at the micro level in their individual lives, but also in terms of thinking about activism and advocacy at the micro level, going from the ground up to maybe influence policy as well. And so I was thinking about like during the first Trump administration, when they did the family separations initially, and there was such an outcry about that, and they stopped doing it. So that's one example. But I guess also too, you know, if we're thinking about that example as maybe one from the left or the center left, certainly in terms of this administration from the center right, a lot of the sort of racist rhetoric around immigrants as poisoning our blood and those sorts of things, that also having an impact on shaping some of the policies and executive orders that are coming from the federal level of the government down as well. So that's the other way I think that I see sort of the framework being different in response to this moment, that the macro and the micro level can influence each other as well. And I didn't have arrows in the original sort of framework. So I've really been thinking more about that as well too.
Thank you. And thanks for saying that. Also, I think sometimes it feels a little bit like you can't correct yourself when something is in print. So I appreciate you making that revision in real time. All right, folks, if no one else has questions, we will take off. Thank you so much, Tiffany. I'll follow up in an email.
All right. Thank you all so much. Have a good weekend, everyone.
All right.